Hi, I'm Megan Kingsley Gale with the Hospital Handbook Project, and today's presentation is about just wanted to introduce you to the Hospital Handbook Project. Today is Tuesday, February 2nd, 2021. I am the founder and director of the Hospital Handbook Project for acupuncturists and their hospital sponsors. I've been doing this as a volunteer for over 5 years now. I believe that patients have the best access and greatest potential for team care coordination when integrative medicine, integrative health is available where they receive care. So a little outline of today's talk. This is going to be, 20, 30 minutes. And this talk is with the intended audience of prospective practitioners who are interested in hospital-based practice, current hospital-based acupuncturists, and then students and educators who are interested in learning about this. So if you're coming to this presentation from another perspective, just know that is how this presentation is intended for that particular audience today. And if you have questions, there'll be links at the end about, how to contact me, or you can just go straight to the website and send me a message that way too. But this is just to tell you a little bit about who we are and what we're doing, our vision, and some updates for 2021. So I'll go over a little bit about my background, who and what the Hospital Handbook Project is, how I define hospital-based practice, our vision, review of some of our current Hospital Handbook Project resources for people who are interested in what we're doing, and those who are current hospital-based practitioners, what we currently have available, a little bit about how you can connect and how you can support this not-for-profit resource. So I am a hospital sorry, excuse me. I am a spouse of an active duty service member, and I have been working on the Hospital Handbook Project since about 2015. And so you'll see as some of these dates, as a family, we tend to change location every few years. And that's just something we expect to do as part of being active duty, my husband being an active duty service member and us supporting him as his family. So I got interested in healthcare system practice while I was a student at the University of Minnesota, and I shadowed physicians both in the family practice, primary care setting, and in hospital-based practice setting. So after I finished my degrees at the University of Minnesota, I went out to Washington State to pursue some employment opportunities and also worked as a Red Cross volunteer, just wherever they needed help. And at Naval Hospital Bremerton at that time, they placed me in the family practice department. I applied and was accepted into the Master of Science in Acupuncture and Oriental Medicine program at Bastyr University, where as part of that program, I had shifts in outpatient clinic shifts in local hospitals, including some shifts at the Seattle Cancer Center. And I had a unique opportunity with work study jobs while I was, in this graduate healthcare program. I got to work in medical records and as the assistant to the HIPAA compliance officer, which were jobs that were available to me at the time. And as I graduated from the program and worked in practice, and including hospital-based practice, that background working in medical records and checking documentation and having those standards of documentation to go to, as well as really having that background in HIPAA compliance and the things that go along with that was really, really helpful to me as a clinician. When I graduated from Bastyr, I moved to be with my husband, who's in Hampton Roads, Virginia. And while we were in Hampton Roads, I was a Red Cross volunteer at Naval Medical Center, Portsmouth. And I just helped out where they needed. And one of those places was the Wellness and Health Promotion Department. And I got to help with a lot of different programs there. And then we moved to Washington State, and I applied and became the first acupuncturist at the Interdisciplinary Pain Management Clinic, the IPMC, at Madigan Army Medical Center. This was a really unique opportunity. The IPMCs are part of the Army's new rollout of their brand new way of doing pain management in the Army. This clinic is a functional rehabilitation type model clinic, and I became a plank owner of that clinic, of that program. So while I was there, I became the licensed acupuncturist liaison to the U.S. Army of the Surgeon General Pain Management. And what that meant is I was the IPMC Army Acupuncturist Practice Standards Committee lead. And this is a volunteer work. So I led and coordinated all of my fellow Army acupuncturists working at the IPMCs to develop standards, guidelines, and metrics for our practice within the Army with specific metrics for the IPMC mission. And then I presented those standards that we came up with to leadership that included the IPMC program leadership, the US Army Office of the Surgeon General, pain management, the Defense Health Agency, which was new at the time, and the VA Integrative Health leadership at that time. I left that job in summer of 2014. I had come back from maternity leave, and we had expected my husband to go to a command that wasn't too far away. It was, a command in the area, so I could keep. I was going to continue with my job. Wasn't expecting any major changes, and then, as happens in when you are part of the military family, he got offered a job that was this wonderful opportunity. So of course we said yes to it. One of the side effects of this opportunity was that he had to leave right away for leadership school, and he was going to be at a command where they were going to be at sea for a lot of the time. So I went back to my workplace leadership and said, hey, this is what's going on. The baby and 5-year-old, and daycare wise, I can only have them in daycare for so many hours a day, according to the rules for childcare. Is there a way for me to work, different hours, part-time hours, or job share? So they, looked into it, and the answer was no. They couldn't change the job or change my job to be part-time. So I had to say no to that job. But I never forgot the lessons learned at that job and some of the barriers and issues that I had as part of leading that practice standards committee. And so one of those things was it would have been really helpful to have civilian standards, national civilian standards to go to. That was just having more civilian standards that I could point to as references would have been, another thing that would have been a useful reference point. So I went to excuse me, one moment. I went to one of our national groups, NCC AOM, and talked with them about can we put together something where we can talk about what civilian standards are for hiring and credentialing of acupuncturists, instead of having all these individual ways of doing it, all these different organizations, be able to bring those people together and talk about what are the similarities of all that, and then be able to publish that as a standard. So the NCCM put together the hospital-based practice task force, where I served as a volunteer. And one of the outcomes of that is we published the document Credentialing of Acupuncturists for Hospital-Based Practice, a resource for diplomates. And I really loved working with that group. And I there's so much more stuff we need to do as hospital-based practitioners about just being able to keep those lines open and keeping the dialogue going and talking about all the different issues that we have. So I said to NCCOM, I would volunteer to lead this. And NCCOM said, that's a great idea, but that is not in our mission, Megan. So go ahead and do that on your own. So, I've got a baby and a baby toddler and, a 5 or 6-year-old. And I'm like, do this on my own. All right. Well, one step at a time. So during about this time, I also had volunteered to serve on Washington State's Acupuncture Professional Board. The Washington East Asian Medicine Association was what the title of it at the time. And I helped out with their help coordinate a data extraction team for their lit review on acupuncture for low back pain. And then also helped as the WIAMA committee chair to liaise with the Washington State Acupuncture Pilot. So I started working on the Hospital Handbook Project as a unique project in late 2015, early 2016. In April through June 2017, we had our first fundraiser for the Hospital Handbook Project. And then, 2017, to 2020, just continuing to develop resources in response to community feedback. Then the last couple years, we've had some growing pains. So happy to report that in early 2021, I am working with a 501c3 entity, working to move the Hospital Handbook Project under the 501c3 entity as a fiscal, under their umbrella as a fiscal aid sponsorship. So this is, exciting news. So this quote by Ralph Waldo Emerson really hits home for me for hospital-based practice. We have hospital-based practitioners, of very small amount of them who've been working in hospital-based practice, for close to 20 years. I have quite a few of them who are about who've been working, closer to 10 years, which is about where I'm at, about 10 years of hospital-based practice, in and out of hospital-based practice, or even consistently at just one place for a good 10 years. And then our largest group of acupuncturists going to hospital-based practice are those who are just beginning, and they're just, 5 years or less. And so I feel like, do not follow where the path may lead. Go instead where there is no path and leave a trail. But this is something that, as the Hospital Handbook Project, we are uniquely positioned to do by bringing together people who have been working in hospital-based practice with those who are just starting out and saying, hey, here is the lessons that I learned. Let's talk about this. These are some, barriers to hospital-based practice. This is stuff that when you're first starting out, here are these resources. And then if you've been practicing for a while, here's the landscape. And as the Hospital Handbook Project, I can coordinate people to talk about, like, here's the landscape, and like, here's what the map looks like. And let's fill in all these different areas by bringing people together and talking about these things. And, collecting what they've learned, and their lessons learned, and then continuing to have discussions about things that come up. And then as time goes on, some things that we didn't have answers for before, our questions are becoming more clear. And those clearer questions help us to get closer to solutions. And then when we do have solutions, being able to share that with the community. So a little bit about who and what we are. We are the go-to resource for hospital-based acupuncturists and their program managers, hospital admin. We are a not-for-profit community resource project. We are a professional networking community. We discuss issues in practice, and we share our innovations, solutions, and more. So it's important I find at some point that people want to understand what it is that I mean when I say hospital-based practice. So for the Hospital Handbook Project, I define hospital-based as working at a facility or organization that is accredited by or eligible for accreditation by the Joint Commission. For those of you who are not familiar with the Joint Commission, they are a nonprofit quality assurance and safety vetting organization based in the US. They accredit a variety of organizations, including hospitals, ambulatory centers, facilities, county clinics, federally qualified health centers, federal health facilities, Department of Defense, the Veterans Health Administration, Indian Health Service, etc., and some hospice organizations. So the core focus of our vision in brief is we are the go-to resource for hospital-based acupuncture work, employment practices, and program standards. Our specialty is that we have a professional network community of hospital-based acupuncturists, clinicians, program managers, researchers, and more. Our vision for the Hospital Handbook Project is to support healthcare organization employment to be available as an employment option for acupuncturists, to become the one-stop professional networking resource for hospital-based acupuncturist employment and program standards, the go-to resource for acupuncturists and program managers in hospital-based practice to connect to resources and program examples, to share ideas, innovations, and avoid reinventing the wheel, to become the one-stop resource for standards, examples, and professional networking related to hospital-based practice on hiring and retaining employees. The question, what does success look like? For example, what does success look like for a functional rehabilitation pain management program? Or what does success look like for an inpatient acupuncture service? As well as looking at clinical metrics, with those questions, looking at, what are the clinical metrics you want to be tracking, especially as a program manager. These are a lot of the looking at these things from a program manager perspective, as well as the employee perspective, to become the authority on hospital-based employment best practices for acupuncturists and hospital-based acupuncture program standards. Margaret Fuller once said, "If you have knowledge, let others light their candles in it." The goal of the project is to avoid reinventing the wheel, to share wisdom, have discussions, identify issues, share solutions, and really grow together as a community. We are a not-for-profit, nonprofit community resource. We have or are developing resources for students and prospective practitioners. Those are practitioners who are interested in hospital-based practice. For the new hospital employee, from getting that offer of acceptance through onboarding up to that 5 years in. For current hospital-based practitioners, for leads and program managers, and our hospital admin. So an example of some recent wisdom share work that we've done. So in spring of 2020, I hosted about 3 Zoom community discussions a week in late March through May on pandemic prep and response. And this started out as just, having space to come together as a community and talk about what's going on. And eventually, we were able to share some solutions as people were coming up with solutions. And so, like I mentioned before, sometimes just getting the question right helps you to get the solution right. So as a group, we were able to share those ideas and innovations as they came up, and then just to be able to host space for people to talk about what they were working on or what were some of the issues they were having, so they could share ideas about solutions to some of those issues. So out of that discussion came a need for being able to host a public event about how acupuncturists can use telehealth both during the pandemic, leveraging that during the pandemic as well as outside of the pandemic. And that public event I hosted in June 2020. The title of it is Telehealth Programs in Hospital-Based Acupuncture Practice, Pivoting in the Pandemic, Lessons Learned, Benefits to the Patients, to the Providers, to the System, Issues, Examples of Innovation, and Discussion. So hospital-based practice is not for everyone. It's not for every acupuncturist. It's not for every physician. But lessons learned from hospital-based practice can help all of us. So, such as documentation standards and how to collect clinical metrics. We have 2 short courses on this as related to pain management, such as using a validated pain scale in your chart note and calculating morphine equivalent dose and things related to that as related to the medication review standard, and standards of employment for clinicians and clinician managers. So one resource we have on that right now is the basics of being an employee in a mid to large healthcare system, which is an interview series, as well as hospital-based practice can also teach us about standards of care for specialty work. One moment here. Such as working in oncology, the experience you get working in an infusion suite in oncology, and working only with oncology patients is going to be able to produce resources from that experience that are different than you would get in a general practice. So like there's the Society of Integrative Oncology as a resource. We do have a resource post about the Research Thursdays oncology post that has some links to resources that are specific to acupuncturists working in oncology. So here's a little bit about Hospital Handbook Project resources. That's just some basic ones that you may be interested in. So I am going to do a newsletter that will be a year in review for 2020, but just the basics are we did pivot, we did change what we had planned for 20, like many people, like we had planned for 2020, we pivoted during the pandemic to host those community discussions on pandemic prep and response, and then had that public telehealth roundtable event in June. And some goals for our work in 2021 is to just keep up those negotiations to move the Hospital Handbook Project under the umbrella of the 501(c)(3) as a fiscal A sponsorship, and then to reorganize the website to be clear on how to access resources by provider type. So if you're a student, provider, or educator interested in hospital-based practice, that resource would be our First Steps resource. For the new hospital employee, we have some resources for them. The established hospital employee, those resources, the program manager or hospital admin, just looking to um, to reorganize the website to be clear for each person, each type of person coming in, how to find their resources more clearly. So resources from the project that are available to everyone, of course, the email list. So if you're interested in our work and not already signed up for the email list, I highly recommend that our newsletter goes out to the whole list. The website, the blog, our public Facebook page, um, our online resources that are currently hosted on the Teachable platform are those things that I have mentioned before. We have those short courses on calculating morphine equivalent dose using a pain scale, the basics of being an employee in a medium to large healthcare system video interview series, and the telehealth roundtable event. We do have the main event recording. There's a link to that here, and I will share these links in the PDF to the group later. If you're watching this, say on the YouTube channel or Facebook group, and there's no PDF associated with that, there will be a link to some of these resources in the notes below the posting. So we did the main event recording for the telehealth roundtable event, and then I have an online resource for this event that's on our Teachable platform that has specific recordings from each of the presenters, as well as PDFs, and then updates on telehealth laws and changes since June. So if you're a student or practitioner or educator interested in hospital-based practice, I recommend you go first to our First Steps resources, which is based on our booklet, Get Your Foot in the Door, First Steps. The First Steps resource, the link this goes to is a resource bundle that includes the booklet and the workbook. It's a resource bundle, subscription based. There's room for talking with people who are fellow students who are in that class, through the comments and so on. And there will be some new videos up in that later in this year. Once you finish that, I recommend the basics of being an employee in a medium to large healthcare system, that video interview series, and then those short courses on pain management. If you are currently working in hospital-based practice, I recommend, if you haven't already, to join our professional networking group. This is a resource bundle as well as the professional networking group, and it's subscription based. And then you might also be probably are also going to be interested in that basics of being an employee in the medium to large healthcare system interview series. And then we also have the issues in hospital-based practice webinar series. So if you'd like to support this nonprofit work, first, join the email list. We send out updates and newsletters through the email list. My favorite, of course, is the cups of virtual coffee and tea, which we have available. You can do the virtual coffee support through the website, or you can support through a subscription-based resource. So if you're a student, educator, or practitioner interested, I recommend that First Steps resource. If you're currently in hospital-based practice as a clinician, I recommend this resource, the networking group. And then if you're interested, we also have options for sponsoring the work. So if you're interested in that, please send me a message on the website through our contact page. There's both individual and organizational sponsorship available. All right, that's all I have for today. Thank you for your time. I hope you found this helpful. Thank you.